What if I told you that something many people your age take without a second thought, something that feels routine, familiar, even reassuring, may quietly be putting extra strain on your heart? I know that sounds unsettling at first, and I want to be very clear right from the beginning. This is not about panic, and it's not about blaming medications. It's about understanding how our bodies change with time, and why certain things that once seemed harmless deserve a closer, more thoughtful look after the age of 60. My name is Dr. Linda Harrison. I've been practicing medicine for 23 years, and for most of that time, I've worked closely with men and women in their 60s, 70s, and beyond. I've sat across from patients who did everything they were told, followed instructions carefully, trusted the system, and were still confused when heart-related issues appeared without an obvious reason. Again and again, I've heard the same words. But doctor, I've been taking this for years. How could it suddenly be a problem? If that thought crosses your mind right now, you're not alone. Healthy skepticism is reasonable. Many medications have been prescribed safely for decades, and they truly do help millions of people. But aging changes the rules in subtle ways. The heart you have today is not the same heart you had at 40. The blood vessels respond differently. The way your liver processes substances slows. The way your kidneys filter changes. None of this means something is wrong with you. It means your body is doing what bodies naturally do over time. What concerns me, and what I want to gently bring into the light today, is how some medications that seem mild or routine can interact with these age-related changes in ways that are easy to miss. The effects are often quiet at first. They don't announce themselves dramatically. Instead, they may show up as fatigue that feels a little deeper than usual, shortness of breath that's brushed off as aging, or a sense that the heart just doesn't feel as steady as it once did. Because these signs overlap so closely with normal aging, they're often overlooked by patients, families, and sometimes even by healthcare providers. You might be thinking, I've heard warnings like this before, or if it were truly dangerous, someone would have told me. I understand that reaction completely. In my own practice, I've had to challenge my assumptions more than once. Medicine is constantly evolving, and what we learn today is built on years of observation, research, and real patient experiences. Very often, new concerns don't emerge because something is suddenly toxic, but because we finally understand how it behaves in older bodies. This matters especially after 60, because the heart becomes less forgiving. It works hard every day, and small additional stresses, ones that would have meant very little earlier in life, can add up over time. The goal is not to create fear, but awareness. When we understand why something affects the aging heart differently, we're better equipped to notice changes early and have informed, meaningful conversations about our health. I want you to know that this conversation comes from respect, not alarm. My patients are thoughtful, capable people who deserve clear explanations, not dramatic warnings. You deserve to understand why doctors pay closer attention to heart health as we age, and why medications that once felt insignificant can deserve a second look later in life. This is about staying informed, staying observant, and recognizing that protecting the heart after 60 often begins with understanding the quiet factors we rarely think to question. As we move past the age of 60, our bodies don't suddenly stop working well, but they do work differently, and this difference matters a great deal when we talk about how medications interact with the heart. One of the most important changes is that the heart muscle itself becomes slightly stiffer over time. Think of it like a rubber band that has been used for many years. It still stretches, but not as easily or as smoothly as it once did. Because of this stiffness, the heart has to work a bit harder to fill with blood and pump it out efficiently. When certain medications add even a small extra workload, the heart may feel that strain more clearly than it would have decades earlier. Another key change involves the blood vessels. With age, blood vessels naturally lose some of their elasticity. They become less flexible, more like older garden hoses than new ones. When a medication affects blood pressure, fluid balance, or vessel tone, these less flexible vessels may not adapt as quickly. This can lead to subtle shifts in circulation that the body struggles to compensate for. In younger adults, the system adjusts quickly. In older adults, those adjustments take longer, and the heart often has to step in to keep everything stable. The way the body processes medications also changes, especially through the liver and kidneys. These organs act like the body's cleanup crew, breaking down substances and clearing them out. As we age, this cleanup process tends to slow. Imagine a sink that drains a little more slowly than it used to. Water still goes down, but if you add more than usual, it can start to back up. When medications stay in the body longer than expected, their effects can build up gradually. For the heart, this can mean prolonged exposure to effects that influence heart rate, rhythm, or fluid levels, even if the medication itself hasn't changed at all. Fluid balance is another important piece of the puzzle. Older bodies are more sensitive to shifts in salt and water levels. Some medications can gently nudge this balance, causing the body to retain a bit more fluid or alter how fluids move through tissues. For a younger heart, this might not be noticeable. For an aging heart, extra fluid can feel like carrying a slightly heavier load day after day. Over time, that added burden may contribute to feelings of pressure, fatigue, or reduced tolerance for activity. There is also the issue of the heart's electrical system, the signals that tell the heart when to beat and how fast. With age, this signaling system can become more delicate. Certain medications can influence these signals in small ways. Again, small changes may mean very little earlier in life, but later on, they can make the heartbeat feel less steady or predictable. This doesn't mean damage happens immediately. It means the margin for error becomes smaller. What's important to understand is that none of these changes are dramatic on their own. Aging doesn't flip a switch. It turns a dial very slowly. Medications that seem seemingly harmless often are harmless in younger bodies. The concern arises because the aging heart and circulation system are less adaptable than they once were. When several small effects overlap, stiffer heart muscle, slower processing, altered fluid balance, and more sensitive electrical signals, the combined impact can matter. This is why medical science places so much emphasis on age when evaluating heart health. It's not because older adults are fragile, but because their bodies are more nuanced. The same input can produce a different output. Understanding these mechanisms helps explain why doctors pay closer attention to medications later in life, and why awareness, rather than fear, is the most appropriate response. I want to share a couple of experiences that have stayed with me over the years, because they reflect what many older adults quietly go through without realizing there may be an explanation. One woman I worked with was 72 years old, active for her age, and very attentive to her health. She told me she was frustrated because she no longer felt like herself. Simple activities like walking through the grocery store or standing to cook a meal left her unusually tired. She wasn't in pain, and nothing felt dramatic enough to label as an emergency. What troubled her most was the uncertainty. She kept asking, is this just what getting older feels like now? Emotionally, that question weighed on her. She had always been independent, and the gradual loss of energy made her feel as though her world was shrinking. She stopped meeting friends as often because she didn't trust how she would feel halfway through an outing. At night, she lay awake, wondering whether she was imagining things or simply failing to accept her age. What made it especially confusing was that she hadn't changed her routine, her diet, or her lifestyle. Everything familiar was still in place, yet her body felt subtly different. Another patient, a man in his late 60s, described a different but equally unsettling experience. He noticed that his heart felt busy, as he put it. Not painful, not racing all the time, just a sensation of being slightly out of rhythm during the day. He checked his pulse often, hoping for reassurance, but instead it increased his anxiety. He had followed medical advice carefully for years and took pride in doing things the right way. When these sensations began, he felt betrayed by his own body. He worried silently, telling himself that if something were truly wrong, someone would have warned him already. In both of these cases, what struck me was not just the physical symptoms, but the emotional toll. The uncertainty led to self-doubt. They questioned their resilience, their memory, even their sanity at times. Friends and family, meaning well, often said, "That's just part of aging," which only deepened their frustration. Aging does bring changes, but not every new symptom should be dismissed without understanding. When we looked more closely, their experiences aligned closely with what I explained earlier about how the aging body responds differently. In the woman's case, her fatigue reflected how a heart that has become a bit stiffer and more sensitive to fluid shifts can struggle quietly, especially when medications linger longer in the system. Her body wasn't failing. It was signaling that the balance had shifted. In the man's case, the sensations he felt were consistent with how an aging heart's electrical system can become more responsive to subtle influences, making normal rhythms feel unfamiliar or uncomfortable. What gives me hope, and what I want you to hear clearly, is that understanding brought relief. Simply recognizing that there was a physiological reason behind their experiences changed how they felt emotionally. They no longer blamed themselves or assumed the worst. Awareness replaced confusion. Their daily lives became less frightening once the mystery was named, even before any further decisions were made. These stories are not unusual. They represent thoughtful, capable people who noticed something change and felt unsettled by it. If any part of these experiences sounds familiar, it doesn't mean something terrible is happening. It means your body may be communicating in quieter ways than it used to. When science and real-life experiences come together, they remind us that clarity itself can be deeply reassuring. What I want to leave you with now is a sense of calm awareness rather than worry. After 60, paying attention to your body doesn't mean scrutinizing every sensation or assuming something is wrong. It means noticing patterns, how your energy feels from morning to evening, whether activities that once felt easy now feel a little heavier, whether your breathing, stamina, or sense of steadiness feels different over time, not just on one particular day. These observations are not judgments. They are information your body offers you. One common misunderstanding I see is the belief that if a medication has been taken for years, it must always affect the body in the same way. In reality, the body is the variable that changes. Another misunderstanding is assuming that heart-related changes must be dramatic to matter. In older adults, the earliest signs are often quiet and gradual. They show up as subtle shifts in comfort, confidence, or endurance. Recognizing those shifts early is not about fear. It's about respect for how the aging body communicates. It's also important to remember that medications are rarely purely good or bad. Most exist because they offer real benefits. The question, especially later in life, is balance. Benefits and risks can change as the body changes. This is why thoughtful, periodic conversations with a healthcare professional are so valuable. Not rushed conversations, not alarming ones, just clear, honest discussions where questions are welcomed and nothing is assumed. I want to be very clear and very calm about something essential. Medications should never be stopped, reduced, or changed on your own. Doing so can be far more dangerous than the concerns we've been discussing. Any adjustment, any reconsideration must always happen with a physician who knows your medical history and understands your overall health. This is not about taking control away from you. It's about making decisions safely, with guidance. Awareness also means giving yourself permission to speak up. If something feels different, you are not complaining. You are participating in your own care. Too many older adults minimize their experiences because they don't want to seem difficult or dramatic. Your experience matters. Your questions are valid. Clear communication is one of the strongest tools we have for protecting long-term heart health. As we age, health becomes less about quick fixes and more about understanding, balance, and partnership. The heart, in particular, benefits from this approach. It works tirelessly for decades, and later in life, it asks for a little more attentiveness in return. That attentiveness doesn't require fear. It requires patience, curiosity, and compassion for yourself. If there is one feeling I hope stays with you, it is a reassurance. Awareness is empowering. Knowledge does not weaken you. It steadies you. Aging does not mean losing control. It means learning to listen more closely and respond more wisely. You deserve care that respects both your experience and your future. I'm Dr. Linda Harrison, and after 23 years of caring for people in their 60s and 70s, I can tell you this with confidence. Thoughtful awareness, calm communication, and guided decision-making go a very long way in protecting the heart and supporting a healthy, steady life as the years move forward.